Hello, thanks so much for joining us, Connect Consulting Services, to talk about pandemic preparedness, preparing for the next waves of COVID-19. We're going to get started. Thank you so much for joining us today. I'm Nora O'Brien. I'm the CEO of Connect Consulting Services, who you're going to hear from our rockstar staff and about different sectors and planning challenges and some strategies for the next wave of COVID. We'll be talking about, and there's also some controversy about what those waves look like. And so we're going to share with you some ideas and concepts. We also want you to share with us kind of what your challenges are, but also some of your strategies, the things that have worked well for your organization. So thanks so much for joining us. We wanted to let you know if you want, we want you to ask a question. There we go. Okay. There we go. If you haven't joined us, you might have used Zoom or GoToMeeting, but they're all pretty much the same. We want you to ask a question because number one, we want to be able to answer those questions, but more importantly, we want to be able to have you share and engage as best we can. And it's hard, I know, sometimes in a webinar environment, but we really appreciate you joining us today. But so this is how you do that. You just go to the question section and we'll be looking for those. We're going to answer those questions near the end of the webinar. Want to let you know here, we've got Eric. Eric is our training and exercise specialist. Do you want to, Eric?
Sure. Good morning, everyone. My name is Eric Engel. I work at Connect Consulting as the training and exercise specialist. I've been in emergency services for over 30 years now. I'm a national healthcare disaster professional and a master exercise practitioner as well.
Right. Great. Next, you're going to hear from, we have Lori Benblatt, and she's one of our planning specialists. Lori?
I am a disaster readiness and recovery specialist. I have been working with Connect Consulting for a while as a planning specialist. I've been in the field for 15 plus years, more so as a clinician. And I've worked throughout the United States and globally. And I'm really excited to be here today.
Great. Thanks so much, Lori. Okay, next up we have Anthony Hurley. He has lots of sets of letters after your name. He'll explain what those are. He's our Director of Emergency Management. Tony?
Hi, everyone. This is Tony Hurley. Spent 37 years in the utility industry before I retired. For the last 4 years, been working for a consultant up to the Director of Emergency Management for Connect. I teach at FEMA Emergency Management Institute, and I'm also a master exercise practitioner.
Great. Thank you so much. Take it away, Eric.
All right, this is just the overall agenda, and due to time, we're not going to go in depth on the agenda. We're going to get right into it. So as you know, pandemics happen. There have been 13 major pandemics in known history. One of the big pandemics that we've done a lot of research on and learned a lot of lessons from is the 1918 flu pandemic. This killed over 50 million people, and it was caused by the H1N1 virus. This was really the most severe pandemic in known recent history, and it had multiple waves, exactly what we believe is going to happen with the COVID-19 pandemic. H1N1 was another recent pandemic that we learned from. This definitely was not as deadly as the 1918 pandemic, but it still had its waves. Virus emerged in the spring of 2009 and caused a lot of problems and really impacted a lot of the healthcare and other aspects of our daily lives, but not as significant as our COVID-19 is. And we have to learn from these former pandemics. We've learned we need to wash our hands, we need to wear masks, we need to practice our physical distancing. Of course, technology has really benefited us in this pandemic response, and we know there's a lot of supply chain burdens getting the PPE that we need because things are steadily running out. And we have to learn from the past to gain knowledge for our future response. Lori?
Sorry, all, I was on mute. Moving on to just a summary of what's presently happening. We see on the slide the current infection rate and death toll. That was as of October 26th. That was 8.7 million. Infection rate, 225.7 thousand. Death rate, that's increased as of this morning. One of the key takeaways that I want to leave everyone with is that this is a very quickly changing impact, and we see this rate changing every day, multiple times a day. You see on the slide also there are two different sites that do a really good job of updating both the state by state and the US and globally, like what the infection rate is and what the death rate is. There's a little bit of discrepancy between the two, as we know data that we get sometimes differs. And so we just want to know that the bigger picture and the global picture is that this is a very serious disease, as we know. Over the last week, we've seen 500,000 cases with an average of 71 or 72 per day. So planning and preparing and adhering to best practices is urgent. We all know the background. It's been here since December. It was discovered in China, and it has been a global pandemic declared by the WHO since March. One of the reasons why it is so quickly transmitted is because this is like the H1N1. It's a new novel coronavirus where people don't have immunity. I'll go into a little bit about the immunity after, but so because there's no immunity in the population, it spreads quickly, and that is kind of a known factor. There's a lot of unknowns. Can we go to the next slide? So what we're seeing is current spikes, current surges, current waves. Regardless of what we're calling it, it's happening like patchwork. I heard on NPR today someone describing it like fireworks because it's so rapid. I think one of the key, like there's a big discrepancy in whether we're calling it a wave or a surge, and technically we're still actually in the first wave as a country. In order for it to move into the second wave, we need to get to decrease enough the infection rate and the transmission rate enough where we just haven't done that as a country. It's still known as a wave or surges. Regardless, we're kind of in the third surge as a country. Different states have gone out of the first wave and into the second wave, but that again is largely state and or county dependent, and that's just for the United States. Public health is largely state mandated, and so we have one of the reasons why we do see this like a kind of like a popcorn effect is because people are traveling and people are going from state to state, but there are different mandates and there are different restrictions. And so where we live in our own community, those are the guidelines that we want to follow while we're there. It's also compounded by other factors. There are seasonal changes. The virus itself is impacted by different seasons, other disasters. There are all these reports now from the smoke from wildfires. People are migrating from hurricanes and wildfires. We saw tornadoes this summer. And so there's just a lot of things that are contributing to the surges that we're seeing. It's impacting all of the sectors, our economy, our mental and behavioral health, our food security, schools, critical infrastructure, healthcare. And I think one thing that we can agree on is that we are in unprecedented and precarious times. This is all new and we're all figuring it out together. Okay, we can go to the next slide. One of this slide is just really showing different scenarios depending on what the infection rate looks like. That will also largely depend on how people are adhering to mask wearing, hand washing, social distancing or physical distancing, as I like to call it, and mask wearing. We're a lot right now. We're seeing, even though people are mostly adhering to mask wearing, depending on where you live, again, as it gets colder and people are moving inside, they're loosening those restrictions. And so it's, they're recommending that even when we're inside, that we're wearing our masks as the winter approaches. So these are, depending on the vaccine also and how the vaccine is distributed, they're just different scenarios that can look, and they extend, for a couple of years from now. Next slide is kind of this common image that a lot of us see as a normal reaction to normal disasters and emergencies. I use that word very loosely, the normal. Usually we see peaks and valleys, and depending on if we have advance notice, like as in a hurricane, we go through this response of like pre-disaster and feeling like the warning and the threat and preparing. And then when it hits, usually, depending on the size and scope, we will go into response mode. People come together where we have a honeymoon phase. You see this, you saw it all over New York City after Sandy, and in Texas and Florida after hurricanes, in Puerto Rico. People come together, they respond, and there's like this short and long-term response into recovery mode. When like we kind of like assess what the damage is, there's this normal peak. The peak goes down to a dip, and people are working through their grief, coming to terms with what the loss is, the size and the scope of the damage, and then eventually we all get to a new normal. So I put this here just as a visualization, so we can see if we stretch this out and had multiple of these peaks and waves, that would be, I think, more appropriate for COVID. That visualization has not come out yet, but just because COVID is so new and it's lasting a really long time, all of these peaks and waves that you might see in the news or different like articles that you read, it would be stretched out. So moving on to the next slide, I really like this visualization because we kind of see how, again, this all depends on how the infection rate progresses. But we see a first wave, and which again, we're still in the immediate mortality and morbidity, and then the second wave in yellow, it's kind of less, and it looks, it's really looking at the overall health impact. So we see what the resource restrictions, the supply chains burdens, and we see how over time that initial impacts on health will decrease. The third wave, we see a restriction on the more like the lengthy chronic conditions, and that won't impact the larger population, but it's still significant, and we still see what we don't know, but we will be seeing what the long-term morbidity will be. One thing we are seeing is a steady increase in the behavioral health and mental health impacts, the impacts on trauma, the economic fallout will be long-term, and burnout. I think it's really important to recognize that people have been working tirelessly and endlessly. And so the blue line, that long-term wave, is where we need to really put our energy and our resources and ongoing planning efforts to make sure that we are protecting that and creating support for those three areas. And with that, we're going to go to strategies for healthcare with Eric to help create those strategies.
All right, thank you, Lori. So challenges that we've seen, not only with the initial but ongoing response, is the lack of space in hospitals. A lot of rooms have been converted from double occupancy to single occupancy. So we're having to readjust the flow of our patients and our inpatient capacity. Supply challenges definitely been a challenge in getting the PPE that we need and maintaining the flow of that PPE coming in. Our ICU and critical care beds are decreasing while our population that really needs these beds is increasing. People were staying at home. They didn't want to come to the hospitals initially, and now they're presenting, some of them very, very sick, and not from COVID, but for other comorbid conditions or other conditions that they had, such as problems with heart conditions, diabetes, even strokes have been increasing. People have been relying more and more on emergency departments and emergency medical services for transport and care than their primary care physicians due to difficulties in getting in to see their physicians. Sometimes the physicians aren't even open. And our absenteeism rates definitely has been increasing throughout this, not only because of possible COVID-19 infections, but also the mental health aspect. The stress levels have been very, very high on staff members. So for some best practices, plan ahead. Get ready now to prepare for this next wave. Plan ahead for this key consumable equipment like PPE, your N95 masks, your isolation gowns, face shields. Plan ahead for staffing as well. Some places are already ramping up their staffing, ready for this possible second wave or this twindemic that they're concerned may occur with the increase of flu as well as COVID-19. Make sure your orders of succession and delegation of authority is in place in case your CEO or your chief nurse executive goes out. Know who's going to handle their job duties. And develop cleaning and possible reuse protocols for your PPE and ventilator management. Plan ahead for use of alternate care sites, possible expansion of one unit into a temporary ICU, or one unit that is maybe a shuttered wing into a temporary area for COVID cohorting. Make sure your EHR are updated for best communications, your electronic health records if you're using those. And if you have alternate care site locations, make sure they're mapped into your electronic healthcare units and have Wi-Fi capabilities. As they begin to appear, regularly assess your use and your burn rates of your PPE. The CDC does have a great free burn rate calculator for PPE use that's out there and available to all. Continue to monitor the situation with your local public and state health departments. Don't just rely on the media either. Please just rely on vetted sources, not just the news media. Reach out early to your healthcare coalitions, your state resources, your local resources for staffing and supplies, such as medical MOUs, memorandums of understanding use of reaching out to your healthcare coalitions for extra supplies, and work together as a team. This is an ongoing response that takes a whole community, not just a healthcare agency, not just a hospital, but working together as a team, internally and externally, to succeed. And continue the use of telehealth. There's been a lot of great success out there with telehealth, and continue the screening to stop the possible transmission of COVID internally to your facilities. Continues to use the masks. I know we're all very tired of using the masks, but learning from 1918, mask and hand washing are critical to stop the spread of this and that virus in the past. And just consider, and always consider, the mental health impact this is having on the staff. Not only are these staff members providing care, but these are your parents too. So we're having to deal with that as well. All right, and that goes on to Lori.
I think she must be muted.
Are you
Muted again.
She's back. Okay.
Thanks, Eric. One of the key piece, I just want to kind of jump back for a second. One of the reasons why we're doing healthcare with education, with infrastructure, is because they are so closely tied together. And this is kind of a unique thing that we're seeing with COVID, especially because of the long-term impact and the long-term response. And so there's so much information that we could have put in here, and it could have been packed with more. So I'm going to run through things a little bit quickly, and then we can ask questions at the end if we want to come back. But so looking at the challenges for school response, you know, schools were kind of thrown into this disaster response mode where they really haven't been a part of it in the past. Shut down really quickly. They had to, teachers and administration and districts had to figure out how to respond and plan for how to deliver, create, and make sure that it was delivered equitably, like education plans and food. And so there's a lot of, right now, one of the big challenges is staff is burnout, just like in healthcare, in a different way. They have all of these extra responsibilities, and creating these contingency plans for remote learning, hybrid learning, in-person learning. So when the wave is moving in and out, schools might also be following that and how they're closing and responding, depending on their local infection rates and what those metrics are. Staff are also holding the space, and families, like for missed milestones. Again, all of this information is actually age dependent. Because of time, we're not going into the different age specific responses or challenges, but milestones for high school students, let's say with graduation, or maybe like a school play, will look different for an elementary student or even a preschool student. And so, but those are big pieces that both staff and family are holding, and holding for a long time. Communication is can be a challenge depending on how information is communicated, developing those communications plans, and also making sure that the information is really understood and implemented well. Looking at the age-dependent social emotional learning and socialization, which we know is vital for our students of all ages. It's also vital for teachers. Just, you know, I think we focus on the impact of students, but like Eric was emphasizing, our staff is really holding a lot of the weight and the burden of this response. There are short and long-term learning implications. We already see that certain colleges are waiving some standardized testing. Tests are being, you know, just kind of, they're throwing it out the window. Students are struggling with learning. Not all students, but especially when we look at students with special needs or access and functional needs, we see more challenges. And there's neurological impacts, both, again, for students and adults and teachers. They're starting to find this research that being on the computer all day, as we might have known before, really has impacts. And we are calling it brain fog. I like the term brain blip, which, you know, you kind of forget about a word, but it's pretty common. And I think people get nervous because they're starting to like see challenges in their thought patterns. It affects our sleep, but just to normalize it, that it is, we are finding that is a common impact. And also the outdoor activities and exercise really have positive impacts on us, and we're seeing the lack of those activities now. We're kind of feeling this cumulative response. So if we can just move on to the next one for some more challenges. Structural challenges, so maintenance, right? How are schools maintaining sanitation practices? Are they doing it in between classes? Are they doing it after school, before school, both within the classroom and hallways? And how is that being monitored and adhered to? It's critical. How are we providing PPE both to students who might not be able to come up with their own, and to staff? Which creates a lot of funding and resource challenges for schools. Schools, again, they're state and district responsibilities. And so this is kind of on them to reallocate how they're distributing their resources. Age and developmental differences I just talked about. And then how are we doing all of this equitably? You know, this is highlighting, COVID in general is highlighting a lot of the inequities in our school system where we're seeing how big those food security insecurities are. How are we feeding families that rely on school lunches? Some schools, depending on where you are in the country, will give breakfast, lunch, and a snack. And so those, with agriculture also being impacted, it's another big challenge. Not all students have access to technology. Not all students can have fast internet, fast Wi-Fi speeds. And so we see communities coming up with different solutions, such as like going into parking lots and using a library's Wi-Fi, or going into like different community centers and figuring out how to use other resources. How are we making sure that students are getting the materials they need? And also, how are we making sure that students who have special needs or who have access and functional needs are able to use this technology in the same way that other students are? If we can just move forward, these are just challenges that all the teachers and districts are dealing with as they're looking at how to adhere to best practices and preparing. So one of a best practice, and this again won't until we find a vaccine that is going to be used, it might be a really long time. We need to continue these practices. So having emergency plans, schools are again thrown into this world, but having different plans for the different surges, it's critical. When we plan ahead and when we prepare, we have that sense of control, and it can help to mitigate the long-term stress, even the short-term stress. We might need to have a materials access plan, materials access plan, sorry, which kind of lays out where different resources are. So if students can travel in hallways while still keeping physical distance, and if a school closes down, we know how to let students and teachers into the school and gather their things safely. Having these extended models, the hybrid models, and the return is really important, and looking both short and long term, keeping weather and different seasons in mind. And also, as Eric emphasized, continued use of masks and other PPE, continued disinfection practices. So if we can move forward, looking at ways to, we also the sanitation practices we talked about, but also monitoring and testing, right? Schools are now also thrown into this. Are teachers really equipped to monitor and test? Probably not, but they are being taught how to at least over Zoom monitor symptoms when students are in school. Is your district using testing protocols? How are they monitoring systems? How are we making sure that we're keeping physical distance, whether that's through pods or cohorts as students walk through the hallways? We also need to modify buses, like different situations that require close contact. So group projects when students are in person, how are teachers able to plan for that? Recess and physical education. These are all just like things that we want to make sure that school districts have different plans for, to make sure that students and teachers are safe. We also want to plan for absences. So not just because of COVID, but like Eric mentioned, we're coming into flu season. Staff could be parents, and parents are also in charge of taking care of their families. So there are definitely, we want to plan for different orders, like succession. So we want teachers who can take a place of a teacher. We use substitute teachers. How are we going to make sure that absences are taken care of? And of utmost importance, how are we going to do this while supporting their needs? Teachers they're just being asked to do a lot of things that they didn't necessarily sign up for, and as well as families. But when you're working from home, a lot of parents are working from home if they can, and also helping their students learn, their kids learn. These are different roles that were unexpected. And so we want to make sure that we're employing different strategies to take care of emotional needs and mental health wellness. So teachers, focus on resiliency, creating different strategies. Let's say, for an example, on Zoom or in person, doing regular check-ins. I've seen teachers who have created like these really fun ways to check in with students almost every day to make sure that they are doing okay. We also have to remember that as students and families are being mandated to be at home more, we do see a rise in other issues. We see social isolation that can impact students with emotional challenges already. We see an increase in violence. So being able to plan for all of these unexpected impacts is also just as important. And again, one of the best ways to be resilient is to be flexible and adaptive and plan and use creativity. If we can move on, because of time, I want to go through some suggestions for planning and preparing. Again, contingency plans, stockpile within schools. We often think about like having PPEs within our hospitals or our community health centers, but having material in schools will help to rely on your school and not have to work with different agencies. It can be a challenge, but preparing ahead might help with that. Looking at non-COVID illnesses, absentees, like I was talking about, other disasters. We saw that a lot this summer, starting last spring with hurricane season and fire season. All of those are things to prepare for. And again, the family stressors and losses. We want to monitor and mitigate emotional distress. Bring in your school social workers, bring in outside your community, your county and state Department of Health often have resources that you can rely on or bring in to help students and teachers mitigate some of the behavioral health and emotional distress. We want to monitor the secondary impacts like I was talking about. We're seeing an increase in violence at home in certain situations. We're seeing social withdrawal. And again, teachers might not know how to identify these situations. So bringing in other experts to help them can help take the stress of this reliance off of teachers, or read and just be aware. Teachers can monitor by looking at students who maybe who are talking less or maybe aren't showing up to school, maybe aren't showing up on Zoom. There's also been an increase, as we know, in mental health issues, but also in substance use. So being able to monitor that is really important. Working as a team, as Eric mentioned, is just as true with education. It requires a whole community response, especially now when we're there. You see this intersection between schools and families and healthcare. If we can move on, we just want to make sure that we are coordinating and collaborating and communicating with each other. Later in the presentation, I have put certain guidelines, some resources for guidelines that can help different schools. They're broad. REMS and CDC and ASPR, SAMHSA, they all have guidelines for how to best care for your teachers, for your school districts. And then also most counties have recommendations. They're based on their local guidance and metrics, so it might be a little bit more specific to your area. Be ready, readiness and planning and preparing, the ability to protect and test and adapt. That cycle of protecting and testing and adapting is really important, and creating best policies for physical distancing where it's not going to create complete isolation. Reopening plans, again, having contingency plans, caring for your teachers and staff, and making sure that you're doing the best practices for well-being policies, and food distribution. I put that here as well because it's where I am, it's a big issue. I know that it's an access issue across the country, and we know without equitable food, our students can't learn. And so just being able to prepare for all of these different things in one plan is really important. And I recommend looking at the guidelines, both the broad ones and also your local, state, or county guidance. If we move on to the next slide, this is just a quick checklist that schools can look at as they're starting to prepare for multiple surges. So looking at your existing emergency plan and protocols, reviewing your metrics, identifying a reopening team, and then perhaps another team to make sure that teachers are getting a break and that your administration is getting a break. Looking at staffing levels, testing protocols, how are things communicated, but also how are people understanding those communications? Looking at your budget and how are certain financial considerations being reallocated? And then are we implementing these plans equitably, and are all students able to receive like the best education that they can? And with that, we're going to move on to infrastructure, which also helps all of these factors happen.
Very good. Thank
Okay.
you, Lori. Next slide. All right, I want to look at this picture here for a minute. So when you take a look at critical infrastructure, this is just a couple of pictures, but critical infrastructure exists out there and is being impacted by numerous natural events out there, which is even creating more of a challenge for us as professionals. When you think about the generation of electricity, you think about the treatment plants, water, dams that are becoming overwhelmed by the flooding that's taking place, and just all the different critical infrastructure. The fact is that with the COVID that came in, things didn't necessarily lessen the workload. And there's been some challenges out there, and it's something I want to talk about. Go ahead. So when you take a look at what is critical infrastructure, there's 16 critical infrastructure sectors that I'm going to show here in a minute. But basically, if they were to fail, it would have a catastrophic effect on security, our national economic security, national public health and safety, and so on. This is something that we all have to be aware of, and we need to work together on this. And when I go to the next slide, I'm going to talk a little bit about, just think about this. So here's your 16 critical infrastructure sectors. So just think about how often you utilize these. The banking institution, IT, hitting a light switch, going in and filling up a coffee pot with water, getting on the highway with transportation, and so on and so on. Lori talked a little bit about the fact that food and agriculture are just critical manufacturing, and the economic impact of everything. So when you take a look at these critical infrastructure sectors, they're a network of interdependencies. So when one becomes overwhelmed and strained, it can have a cascading impact on the others. Just like with any event, we get hit by a natural disaster, for 6 weeks, we're all in that recovery mode. But what's been happening now is that in combination with COVID, it's even been more challenging. Next slide. So when I take a look at this is the traditional impacts that, certainly over the last 40 years that I've been used to: flooding, hurricanes, wildfires, lightning storms that have impacted. And, and I think about all the different types of critical infrastructure out there: utilities, refineries, ports. Just every agency is impacted to some degree, and we've seen it time and time again. If you want to go to the next slide. But this is just some of the critical infrastructure challenges that, in talking to some of our clients, it's just been something that has taken place. Increased transmission risk. The fact is that individuals have continued to travel. So now you've got the situation where if you're traveling, you're wondering if you're at risk. Plus the individuals that are interfacing with these individuals, at the airports, the ports, the hospitals, the individuals coming in and out of hospital. As Eric said, individuals may not be able to get to their doctor, so now they're using the hospitals. And then you have essential on-site and non-essential off-site personnel. Not everybody can be working from home. One of the ones that I'm closest with is, and it shows down a couple of bullet points below with the control centers, is think of generation plants or refineries where you have a control center and you have to keep that control center up and operating. If you're lucky enough to have two, a lot of individuals have an A and a B shift where they sanitize it while the other control center is being used, but some don't have that luxury. So what's happening is that while people are then taking shift, they're going in, they're trying to sanitize those areas, and they're having policies so that if anybody were to travel, you have to notify, even on personal business, they're asking for you to notify your supervision, so your supervision can then take steps to ensure that you're not going to come in and, in essence, maybe make an entire shift ill, and it's just something that's been out there. Then there's all the reduced staffing. Eric talked about it a little bit. Absenteeism, individuals that have been called to work, but maybe they're resistant because they're just not confident, or they don't want to put their family at risk. I know that I have a 1-year-old grandchild, and I would not do anything that was going to put that individual, that young man at risk. So the fact is that these are just all matters that everybody has had to deal with. Strained supply chain. The toilet paper is the one everybody talks about, but there has been, just part after part after part and pieces of equipment that are not available. So what happens with those critical infrastructure sectors when all of a sudden critical parts aren't available because a factory is not up and operating at capacity, either because of absenteeism or maybe they just shut their doors? Mutual aid. The different sectors have mutual aid agreements. I'm most familiar with the utilities, but how many hurricanes or major storms has hit where individuals have been asked to get in a vehicle and travel hundreds of miles away to assist a mutual aid, but now you're going into hotels that have not been staffed for a while. How do you put all these people in a restaurant when a restaurant's only got 25% capacity? How do you spread them out there? How about two people in a vehicle? Or how about working in close proximity? I spoke to someone recently that because of a piece of equipment that went bad, the 4 individuals had to work in a confined space. There was no 6-foot separation. They had to be working together. So the fact is that this can be very, very challenging for individuals, and individuals have put those processes in place to try to be as safe as possible. But again, a lot of good has come from people working together and communicating. Informational webinars and communications like this, where individuals can just share ideas, and I hope that some individuals share some ideas when we get to the questions. Nora?
Sure. Yeah, about the healthcare resources, what we have done, there are a lot of healthcare resources for COVID, obviously, because it's a healthcare, are doing their first line of defense in meeting those challenges for mitigation, and then hopefully taking those best practices that are impacting other sectors. But the CDC and the Centers for Medicare and Medicaid Services refers to guidance specific to COVID response. We wanted to make sure that you saw these resources, which has the use of personal protection equipment specific for healthcare, because they're a little bit different standards because they're actually doing the direct patient care, and obviously those that are highly infectious. The FIT testing is about looking at making sure that if you're wearing that personal protection equipment, FIT testing is done for the N95 masks to make sure that the best respiratory protection is available. Screening, temperature checks, testing. Well, these resources are specific to healthcare. There are some best practices that if you're in other sectors, you're welcome to look at them. We also have shared other resources as well, but hand hygiene and donning and doffing, whereas schools or other critical infrastructure are not going to be, doing direct patient care, et cetera, but just understanding some of those resources, that's a great idea. Also, the Assistant Secretary for Preparedness and Response is the agency, the federal agency that is responsible for the healthcare hospital preparedness program, and they have an amazing set of resources at Ask for Tracy. You can just do any kind of search for any kind of healthcare provider, all 17 provider types for CMS. And there's some great technical resources, training tools, templates, resources specific for, if you're dialysis versus hospital versus skilled nursing. Healthcare training resources also through Ask Me Tracy, and then FEMA has some best practices around coronavirus best practices. We want to make sure you saw those resources. In addition, so Connect Consulting Services, the core services that we've been offering for many years is to healthcare organizations. So we developed, there are the Centers for Medicare and Medicaid Services emergency preparedness requirements that came out in 2017. We follow those changes closely because there's been a lot of rule changes specific to that. For example, in 2019, the omnibus burden reduction, participation final rule. So what we have developed is a compliance toolkit. We also have a school toolkit as well, but this lays out everything that you need to do to be compliant with the CMS Emergency Preparedness Toolkit specific for healthcare. We have a school one. We're working towards critical infrastructure tools, but our goal is to provide you those resources so that you, whether it's training, drills, exercises, incident management, hazard response guides. So if you want to be able to do it yourself, this is the best tool we can provide you. And you can go to the link at the bottom and purchase it directly from our website. Okay, Lori, do you want to talk about the resources for education?
Sorry, I was muted again. So what we see here is more of like the broad and global resources. Like I said, every state and county should have their own guidelines and their own resources for specific data and metrics and different plans, but and also guidelines of how to reopen schools and how to stay open. So CDC has one for schools and childcare settings, and one specific consideration. So looking at like more special needs and different like areas within schools. The Readiness and Emergency Managers in Schools is a great resource. They work with like all disasters and emergencies, and they have a really good repository of information specific to COVID. I put Washington State. They have a really great page that is broad. It's not just specific for Washington. They have really good outline for plans, and they separate for families and teachers and students, and also those with special needs. The Interagency Network for Education in Emergencies, it is a global resource, but they also, it's a really good resource because they have information in a lot of different languages. So in communities that have communities with like immigrants and refugees, or English as who don't speak English proficiently, this is a great site to look at and to get different ideas for plans and guidelines. And then the Department of Education has one. SAMHSA is the Substance Abuse and Mental Health Services Association. They have one that also includes a lot of behavioral health and mental health information, and then different toolbox and tips and tricks.
Great, thanks. So we've got about, we're now at the question section of our webinar. We will also send out a very quick four-question survey after, because we want to hear from you about how we did, but more importantly, what your planning challenges are, and also what some of your strategies are, because we're all about sharing best practices, and that's something that's very, we say in emergency management, we steal shamelessly, but we share selflessly, because that's really important. We do have a couple of questions that have come in. Our first question, and you also can go to our question section now and put those questions in. The first question we have is, are we awarded CEUs for this webinar? And the question is, and the answer is no, we don't currently offer CEUs, although it's something we're considering. And if you have resources about what specific positions that you're looking for continuing education units, if you could put that information in the survey, that would be really helpful for us. Part of the challenge that we have on CEUs is there's so many different, was it nursing? Do we do it specific for emergency management? There's all sorts of specific question about what kind of positions that you're looking for, nursing home administrators. Okay, so we'll let you know. The next question, do you envision organizations will invest more in business continuity management rather than just having a few pages of business continuity plan based on the learnings from COVID-19? That's a really good question. I'd actually kind of like all three of our speakers to answer that question. I can tell you that's one of the biggest things we get asked to do lately. Business continuity has been high on a lot of people's minds since COVID, but do you want to say what kind of business continuity work that you're doing, Eric?
Oh, we've had an in-depth business continuity plan for quite a while, but I know some places do not. So hopefully lessons learned from this will demonstrate the importance of business continuity, delegations of authority. There's plenty of requirements that are out there that mandate that we have to have these,
Right.
and people haven't taken those very seriously. But now with the lessons learned from COVID, it's just demonstrating just how important these really are.
Yeah. Tony or Lori, have anything to add about the need for business continuity planning?
Yeah, I think that this is Tony. I think that there's going to be a lot of folks that are going to realize that they either don't have a business continuity plan or that it is so aged that they have not updated it in years. And when I showed the one picture there of what we were used to dealing with, and all of a sudden now we've got pandemic, even on the heels of H1N1, the fact is that a lot of the calls that I'm getting now are related to, would you be able to come in and help us and make sure you include the pandemic contingency as well? So I'd say yes.
Lori, anything to add?
Yeah, I would say absolutely. Just to piggyback on what Eric and Tony said, I think within the education sector, they're looking at plans that may have been created because they're mandated and sitting in a drawer for years. And they're really revamping those plans to include different areas, and again, how to support teachers and how to have different contingency plans, but also looking at the types of learning, and that's being included in the business continuity plan to make sure that the types of learning are held up as just as important as like making sure that that preparedness is happening. And so looking at like remote learning and trying to figure out different strategies for when schools get impacted in general, not just they're including COVID as like a learning tool for other disasters and other things that might happen that shut down schools temporarily.
Sure, I agree. We have another question. The question is actually around, let's see, which industry sectors do you believe will be able to respond better to COVID than others, and why? Which sectors did better in responding to COVID and why? It's a good question. I mean, it's a broad question.
Critical infrastructure sectors? Is that what it says?
No, just which sector, whether it's healthcare or who did best? I don't think we're all just mitigating the best we can. But that's an interesting question.
And Nora, on that one there, I mean, there's no doubt about it that healthcare was able to adapt because of just because they're also used to sometimes having that environmental issue where if they're in an ICU ward, they're geared up with PPE, and then you have health workers, first responders that also, if they go into an area that could be contaminated, they've also got PPE and equipment, and they're trained with protocols. So there's no doubt about it that sector probably has a leg up on the others. As far as the other ones, when I talk about utilities and ports and refineries and just some of the other areas, a lot of this is new. Certainly they put on a hard hat, that's their PPE, or maybe wear steel-toed shoes. But when it comes to having to be aware that they have to sanitize their, things they touch, to wear the mask, not staying in close proximity. I see it all the time when I pass a construction site where you're so used to everybody getting around and working on one particular area. So I think that that's going to be the challenge, is that individuals that haven't had this as a culture have got to learn it. I think people are learning it quickly, but I still see that sometimes they forget. So I don't know if there's any particular sector that is going to be behind. I think there's a group of them.
Right.
Yeah, I agree. I mean, same with the education sector. They've kind of been thrown into this response, like this cycle of response and preparing, and maybe short-term recovery, just for short blips of time, but they were thrown into here. And I think just like critical infrastructure, they're doing the best that they can to figure it all out, as compared with healthcare, which, healthcare is kind of trained and has been responding to different disasters. So they have lessons learned, where with schools, I think they're doing a great job, but I think it's going to be an ongoing learning process, and how to make sure to continue to do it equitably also.
Right, I agree. We got another question here. Do you agree that the increase in cyber threat, nation state attacks to critical infrastructure during COVID will continue? Let's see.
I would say yes, for the simple reason is so many people are working from home, and a lot of companies had to put together their off-site practices and policies so quickly. They had to bring in softwares that they may not have had because they did not allow individuals to work remotely, and that is proving to be fatal in regards to cyber attacks. I think they're shoring it up, but in everything that I'm reading and all the notices I get on a daily basis, individuals, with every good thing comes a bad thing, and the bad actors out there are always figuring out how to manipulate a situation, and they're definitely taking advantage of this situation.
Yeah, for sure. And it mentions, I think it does reinforce the need for organizational resilience, and because it's not just what we're going to do to respond, but where those continuity plans are crucial, because you're looking about not just surviving the disaster, but thriving afterwards. Because at some point we will be in a post-COVID world at some point, and many people don't quite know what really knows until the vaccine's available and what the outcome is. But that organizational resilience and the need for that resilience will just continue. So, okay, keep going here. I think I have one more question. You're welcome to keep the questions going. Okay. All right. I think that's all our questions. We also wanted to share with you, let's see. We also want to share with how we might be able to assist you. So this is some of our support services that we offer. Obviously, pandemic response and recovery planning, that's been kind of key. Part of that, of what we've been offering this year, is one of our #1 requests has been COVID-19 after action reporting, kind of mid-event, and saying, what have we done so far? How are we doing? How are we going to get ready for the next wave? So we've been getting a lot of those requests, and that's something we can support you on as well. Emergency operations management planning, continuity planning, business continuity planning. But also de-escalation and workplace violence and that kind of training, whereas kind of what the stress and the effects that Lori was referring to, those kinds of things unfortunately are not going away, and actually in some ways you could say exacerbated by the stress of COVID, the stress of people job loss, or whatever those things are related, or the scare of the actual COVID itself. What we can do, all those drills and exercises, we can also do audits and improvement planning. So you can go directly to that hot link there and book a time with us if you want to know how we might be able to help you and help your organization and figure out what we can do to support you, because we're here to serve you. That's our goal, is doing that. We can do everything that we can do to support your response and recovery efforts to make sure you not just survive, but more importantly, thrive after disaster. And this is our contact information. We've actually given you 1 minute of your day back. We want to say thank you. I mean, our wonderful speakers, I just so thankful to have work with these folks every day, and hopefully you get to meet them along the way as well. There's our contact information. We're going to send out the webinar content. You are going to get the slides. Everyone asks that question all the time. We'll send the recordings, we'll send the slides. That should go out shortly. And also, if you can share, complete the survey, 4 quick questions of how we can better serve you, and you can share your best practices as well. So thanks so much for joining us today. We appreciate it, and we'll look for future webinars from us in future months.